Respected judges, teachers, and my dear friends, very good afternoon. I'm Dr. Pratibha Devi Nivian, and I'm here today to present on tear biomarkers in thyroid eye disease, the first Indian study. Thyroid eye disease is a very complex autoimmune disorder. Understanding about the pathogenesis is evolving. We know that the immune dysregulation in the orbit causes antibodies to self-antigens that in turn causes multiple reactions inside the orbit, causing either a fibrotic disease or a fatty disease. We know the TED presents in varied presentations from a simple mild lid retraction to a gross disfiguring proptosis with dysthyroid optic neuropathy and exposure keratopathy. What do we do now for such patients? We treat based on the inflammatory scoring by either the clinical activity scoring or the VISA scoring, and we treat them with steroids, immunosuppressants, radiotherapy, and targeted therapies, whichever is available with us. But what is lacking? We treat after the disease is well established, and most of the audience here would agree with me that treating an active thyroid eye disease is very challenging as well. So what could be ideal? Identify a patient who will probably develop a disease, an active disease, and treat them before they develop a full-blown disease would be an ideal thing. So how can we identify such patients? To look in for biomarkers from various human tissues. Tears could be an ideal source as it is in direct contact with the eye. The lacrimal glands are affected, and the tear fluid is easy to procure and it is extremely non-invasive. So with this background, I did some literature search and I did find so many researches done on this aspect, and that one particular article from the Biomolecules Journal had compiled a meta-analysis on this particular thing, and most of the authors have proven that few of the interleukins, the inflammatory markers, are raised in TED. With this background, and since there was no study done in India, we aim to look for significant markers in tears in TED. My study was a pilot study done prospectively after ethics clearance. We diagnosed TED based on Gorman and Bartley's criteria. We did the activity score based on the VISA scoring, and severity was assessed by UGOGO. We took tear samples from 2 tertiary care centers with Schirmer's tip methodology, and storage was followed meticulously in both the centers, and the sample was analyzed in another tertiary care center lab with proper protocols followed, and we collected samples from healthy controls, patients with TED and patients with thyroid eye disorder but without TED. We excluded patients with other systemic and ocular disorders and not willing for the study. We performed the multiplex ELISA, and we did study the inflammatory markers which have been proven to be affected in TED. Our study had 19 patients with TED and 13 controls and 11 patients without eye disease. We had 11 patients in the active disease group. This was the gross result which we got from our study. We found most of the inflammatory cytokines were elevated. However, interleukin 6 and interleukin 10 were significantly elevated in TED group, suggesting they could be potential markers to induce an activity, or they could be even a good prognosticative marker to look in for relapse of the disease. And we also noticed that interleukin 6 was, the activity was a strong risk factor for increase in IOP, and we did notice that IOP was directly related to dysthyroid optic neuropathy. Interestingly, we also noticed that in literature, antagonist to interleukin 6 was used for treatment of thyroid eye disease. Randomized control trials have been done, and they have successfully proved to treat the active thyroid eye disease successfully. And we did notice that there are a lot of targeted therapies available for the treatment of active thyroid eye disease. So what could be the future? The biomarker detection can give us a clue as in who would succumb to the disease, and to look for potential markers and treat them with specific antagonist even before the activity scoring is 4 or more could probably avoid the high dose of steroid treatment. And this could also be one of the prognosticative marker, and to look in for a relapse in patients, most importantly in a very non-invasive manner. So to conclude, tear biomarkers can be a promising clue to diagnose patients at the risk of developing sight-threatening complication in TED. As already discussed in other specialties, also these biomarkers are in vogue. So these are my acknowledgements. These are the people who helped me throughout the study, and thank you for this wonderful opportunity to present in this great session.
Can I ask a question?
Yes, sir. Yes, sir.
IL-6, as you know, is an inflammatory biomarker.
Exactly.
And IL-10 is often seen in the lymphoma when IL-10, IL-6 ratio is elevated. You have seen both IL-6 and IL-10 elevated. How do you explain?
Yes, sir. Interleukin-6 is an inflammatory marker. Interleukin-10 is an anti-inflammatory marker. The body always has, probably this is the thought process in my mind. When there is an antigen, the body always increases the antibody production as well. So when the inflammatory marker also increases, probably the body also tends to produce the anti-inflammatory marker also more.
Did you look at the IL-6, IL-10 ratio?
In this particular study, I have not currently analyzed that, sir, in this particular thing.
In the same line, I would like to ask you, these are basically biomarkers of inflammation, right?
Yes,
So because we know that thyroid eye disease is associated with dry eye disease and other inflammation. So is this biomarker specifically targeted to thyroid or due to the dry eyes and the inflammation that we are having?
Both in thyroid eye disease and in dry eye disease, the basic pathogenesis is inflammation. So we are only targeting the inflammation with specific anti-inflammatory agents, the targeted therapies.
Thank you.
Thank you.